Hello everyone, good morning, good afternoon, and good evening. Today, as a requirement in my subject Teaching Strategies in Nursing Education, I will be presenting to you an audio-visual aid as well as demonstration about my chosen topic. The topic is all about infant hypoglycemia. So without further ado, let's dive in and set our minds to know some interesting facts about neonatal hypoglycemia. Hello everyone, once again I'm Lovely Jane Alejo, and our topic for this presentation is all about neonatal hypoglycemia. So what are my objectives in this presentation are: first is for us to be able to identify what is neonatal hypoglycemia. Second is to recognize neonates at risk of developing hypoglycemia. Third is to recognize symptoms and complications of hypoglycemia in neonates. Fourth is for us to know what are the preventive measurement of hypoglycemia in newborn. And lastly is for us to be able to know the proper way of taking blood sugar in neonates. So first, we will talk about what is hypoglycemia. So what is hypoglycemia in newborn baby? So we need to identify what is hypoglycemia first. Hypoglycemia is when the level of sugar or the glucose in the blood is very low. Glucose is the main source of fuel for the brain and the body. And the normal range of blood sugar in newborn is 50 mg per dl to 110 mg per dl. This range of blood sugar, it is based on the stable program of neonates. So what causes of hypoglycemia in newborn baby? So we have first, poor nutrition for the mother during pregnancy period. Second, there is making too much insulin because the mother has poorly controlled diabetes during the pregnancy period. Third, there is incompatible blood types of mother and the baby. So there is a severe hemolytic disease of the newborn. Fourth, there is a birth defects. Fifth, there is a congenital metabolic diseases or hormone deficiencies in newborn baby. Sixth, there is not enough oxygen at birth. So during at birth, the baby has lack of oxygen or blood going to the brain. So this is commonly called birth asphyxia for newborn. 7, the newborn has liver diseases. And lastly, the newborn may have infection. So which newborns are at risk for hypoglycemia? So these are the babies at risk for hypoglycemia. Babies born to mothers with diabetes. So when the baby born with diabetes mother, so they will have diagnosis IDM. So this is infants of diabetic mothers. So if the baby born with the mother with the diabetes that is not well controlled during the pregnancy period, the baby is exposed to a high blood sugar level. The second one is babies who are small of gestational age, or the IUGR, which means intrauterine growth retardation. Babies who are preterm babies with low birth weight. We considered also babies born under significant stress is at risk for hypoglycemia, and also babies with mother taking substance abuse during the pregnancy period. And lastly, we considered also babies who are large for their gestational age. So these are the risk factors that newborn may cause hypoglycemia. So now, let's move on to the next slides, which means how we will identify or how we will assess babies having hypoglycemia. So we need to know what are the signs and symptoms. So we need to assess if there is any tremors, jitteriness of the babies, if there is any high-pitched cry, if there is any lethargy, meaning the baby having lack of movement and energy, if there is hypotonia. Hypotonia means there is a decreased muscle tone. Also, we need to assess if there is any poor feeding and poor sucking for the babies during feeding period. And lastly, we need to know or we need to check the body temperature of the baby. So how we will diagnose baby having hypoglycemia? A simple blood test for blood glucose levels can diagnose the problem. So we need only to check by using the glucometer, and our site is on the foot of the baby, and we just only prick on the designated site for pricking. We don't need to prick the baby's foot in the center to avoid any complications in the nerve. So how is hypoglycemia being treated? Hypoglycemia can be solved with extra feedings of breast milk or any formula. And if blood glucose levels are extremely low, in the NICU department, the doctor may order the baby will be given glucose solution via IV. So we will start by D10 water. So what are the complications of hypoglycemia? We have two complications. We have seizure and brain injury to the babies. So how to prevent any complications? We have prevention of hypoglycemia. So in many cases, there may not be a way to prevent hypoglycemia in a newborn baby. For a baby with risk factors, healthcare providers will need to watch carefully for the signs and treat as soon as possible. Mothers with diabetes should keep their blood glucose level in a normal range during pregnancy period. This may help lower the risk of their baby. Now, my last slide is all about my take-home message. My take-home message is, the littlest feet make the biggest footprints in our hearts. Thank you for listening to my lecture. And the next video that you will gonna see is the demonstration on how to take newborn babies' blood sugar. Thank you. Okay, this is the demonstration how to take the RBS of newborn. So first thing you will do is to check the physician's order. Okay, after checking the physician's order of the baby, gather your equipment. So these are the equipments that we are using to have this one blood sugar monitoring chart to put the results of our RBS. We need this one glucometer. We need this glucose strip, and the one we will bring this one. We need the cotton balls, we need the plaster, and we need the alcohol swab. So now, check your baby's identity. You have two ID band. So check the first one if this is your patient. So this is son of Faisal, Faisal. And then you also check the other one, the identity of the patient. So if this one is correct, now I will do my hand hygiene. After my hand hygiene, I will use the gloves. Now, for pricking the baby's RBS, we will use the area on the foot. First, we will warm the area. After warming, that's the time you will disinfect with alcohol swab. We are doing with the circular motion, and after this alcohol swab, we will wipe with a dry cotton ball. Okay. Now we will set our glucometer, if it's working or not. Okay. And that's the time. After that one, we will now prick our babies. Okay. After pricking, we will dress the part we punctured. And then we will write the result in the blood sugar monitoring sheet. And then you discard also the things that you use. This one, sharp, will be in the sharp container. And then this one, you discard in the regular waste bin. Together with your gloves. Thank you.